Hello, Andrew Colsky from StopMyOCD.com. Today we're going to answer a very common question. Is it a heart attack or is it a panic attack? Well, there's some very specific differences and we're going to go into those. So by the end of this video, you will clearly understand heart attacks, panic attacks, and even anxiety attacks. So let's get started. So what's a heart attack? A heart attack is also called a myocardial infarction. What does that mean? It's a sudden blockage of blood to part of the heart muscle. And that blockage is usually caused by some sort of a blood clot in the coronary artery, and that's the one that supplies oxygen to the heart. So if you block that oxygen, then part of the heart muscle starts to die, and that's when you have what we call a heart attack. So what are the symptoms? Heart attack symptoms are severe chest pain or discomfort. So the pain feels like pressure, squeezing, fullness, or a heavy weight on the chest, and it may last for more than a few minutes. Now that's important. It lasts for more than a few minutes. Pain radiating to other parts of the body, like the arms, especially the left arm, the back, neck, jaw, or stomach. Additional symptoms would be shortness of breath. You may feel breathless and have difficulty breathing. Or your skin may become clammy and sweaty. Some individuals may experience a feeling of nausea or may actually even vomit. And you may feel dizzy or even faint. Let's compare that to a panic attack. A panic attack is a sudden and intense surge of fear or discomfort that reaches its peak within minutes. Panic attacks are often characterized by a sense of impending doom or terror, even though there may be no immediate danger present. They're part of an anxiety disorder known as panic disorder. So these come on quickly and intense, and then they eventually fade away, versus a heart attack, which comes on and more likely stays with different types of pain. But let's look at the symptoms of a panic attack. You may have palpitations or a racing heart. So your heart is pounding rapidly. Sweating, profuse sweating, especially on the palms or forehead. This is what we get when we're anxious. You may experience uncontrollable shaking or trembling. Shortness of breath, you could have like a heart attack, feeling like you can't breathe properly. Chest pain, a feeling of pressure or tightness in the chest. That is similar to what you would see in a heart attack. And you may include stomach cramps or a queasy feeling. Now that's different from the nausea or the vomiting. Here we're looking at stomach cramps and queasy feelings. Feeling dizzy, lightheaded, or faint, it's a sensation of losing control or going crazy. Chills or hot flashes may come on, so there's sudden cold, sudden warmth, those types of things. So panic attacks can be triggered by specific situations or can occur unexpectedly, even during sleep. After experiencing a panic attack, you may worry about having more attacks, and that leads to increased anxiety and potential avoidance behaviors. So the term anxiety attack, now we move from heart attack, panic attack, and now we're talking about anxiety attack. And anxiety attack is not an official medical term. And oftentimes it's used interchangeably with panic attack because they're basically the same thing. But some individuals use it to describe intense episodes of anxiety that are not as sudden or intense as panic attacks. So anxiety attacks, if we use it as a separate term, they're typically associated with generalized anxiety disorder or other anxiety disorders. And unlike panic attacks, they may develop gradually and last for a more extended period. So what are some symptoms of anxiety attacks? Excessive worry or fear. You're feeling anxious, tense, or on edge for an extended period of time. You may feel restless and unable to relax. You may have muscle aches or tension due to ongoing anxiety. Difficulty concentrating. It's hard to focus or experience the mind going blank. Trouble falling asleep, staying asleep, or having restless sleep. So it's important to note that while the terms panic attack and anxiety attack may be used differently by some individuals, medically they're often regarded as the same phenomenon and treated similarly. So to summarize, A heart attack is a medical emergency caused by a blockage of blood flow to the heart. Panic attacks are intense episodes of fear and discomfort without a clear trigger, often associated with panic disorder. The term anxiety attack is less commonly used and may refer to intense anxiety episodes associated with generalized anxiety disorder or other anxiety disorders. If you or someone you know is experiencing symptoms resembling a heart attack or panic attack, seeking immediate medical attention is crucial. So I hope that gives you a better understanding of the differences between heart attacks, panic attacks, and anxiety attacks. I do have another video that talks about how to deal with a panic attack effectively. So with all of the information out there on my channel, you should be able to find some things that are helpful to you. So I'm from StopMyOCD.com. We have a free support group for individuals or family members or loved ones of those with OCD. You can sign up at StopMyOCD.com. And thank you for watching this video.